Hello, I'm Maruk Said, your microbiology guide. Let's explore in-depth micro techniques and uncover groundbreaking insight together on this educational journey into the fascinating realms of microbes.
Yersinia pestis is a gram-negative coccobacillus classified within the Enterobacteriaceae family of bacteria. It is the causative agent of a disease called plague, which is transmitted primarily through rodents, such as rats and prairie dogs, along with their fleas. Plague is highly contagious, and there have been 3 major pandemics throughout human history. One of these, famously known as the Black Death, wiped out up to 1/3 of Europe's population. Yersinia pestis has a thin peptide doglycan layer, preventing it from retaining the crystal violet dye during gram staining. Instead, like other gram-negative bacteria, it takes on a pink color when stained with safranin dye. With right Giemsa and Wason staining, it exhibits bipolar staining, meaning only the poles of the bacteria are stained, while the rest remains unstained, giving it a safety pin appearance under the microscope. Yersinia pestis is non-motile, non-spore-forming, and facultatively anaerobic, meaning it can survive in both oxygen-rich and oxygen-poor environments. It is also facultatively intracellular, allowing it to live both inside and outside host cells. It is oxidase and urease negative, indicating it does not produce these enzymes, but it is catalase positive, meaning it produces the enzyme catalase. Additionally, it is indole negative, meaning it does not convert tryptophan into indole. Yersinia pestis grows well on MacConkey agar, sheep blood agar, and chocolate agar. MacConkey agar is used to determine whether a bacterium can ferment lactose, as it contains lactose and a pH-sensitive dye. When bacteria ferment lactose, they produce acid, causing the pH-sensitive dye to turn pink, resulting in pink colonies. However, non-lactose fermenters, like Yersinia pestis, cannot alter the pH-sensitive dye, leading to the formation of colorless colonies. On sheep blood agar and chocolate agar, Yersinia pestis forms opaque yellow colonies with a distinctive appearance resembling fried eggs. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. The triple sugar iron, TSI test, can be used to assess hydrogen sulfide production. This medium contains 3 sugars, lactose, glucose, and sucrose, along with iron and a pH-sensitive dye. If the bacteria produce hydrogen sulfide, it reacts with the iron, forming a black precipitate in the test tube. Yersinia pestis does not produce hydrogen sulfide, so no precipitate forms. The pathogenesis of Yersinia pestis involves 2 key components: transmission of the bacteria by fleas and the host's response to the bacteria. First, fleas become infected with Yersinia pestis by feeding on a bacteremic host, such as rats, allowing the bacteria to colonize the flea's midgut. When the flea bites a human, it regurgitates the bacteria into the bite wound, initiating infection. Once the bacteria enter the host, neutrophils and macrophages rush to the wound site to eliminate the bacteria. Yersinia pestis has a capsule made of a capsular antigen called F1, which has anti-phagocytic properties. However, inside the flea gut, the bacteria lose this capsule, making them vulnerable to destruction by neutrophils. Unfortunately, macrophages are less effective at killing the bacteria. If the bacteria are engulfed by macrophages, they can survive inside and be transported to the lymph nodes, where they replicate and cause lymphadenopathy. Once inside the macrophages, Yersinia pestis uses its virulence factors to avoid destruction. It begins producing its capsular antigen F1 again and utilizes a type 3 secretion system, T3SS, a set of proteins designed to suppress the immune response. Through T3SS, it injects Yersinia outer proteins, YOPs, into the macrophage, which block the secretion of pro-inflammatory cytokines like TNF-alpha and IL-8 and inactivate the macrophages, allowing the bacteria to evade phagocytosis. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. Additionally, Yersinia pestis produces a siderophore called Yersinia bactin, which actively seeks out iron and delivers it back to the bacteria. Iron acquisition is a crucial step for Yersinia, as it allows the bacteria to thrive and replicate effectively. Finally, the macrophages burst, allowing Yersinia pestis to spread throughout the body and cause 3 different forms of plague: bubonic, septicemic, and pneumonic. Bubonic plague occurs when Yersinia pestis spreads to nearby cells in the lymph nodes, causing the lymph nodes to swell. These swollen lymph nodes are called buboes, hence the name bubonic plague. From the lymph nodes, the bacteria can enter the bloodstream, leading to septicemic plague. At this stage, Yersinia pestis has reproduced its capsular antigen F1, which prevents circulating neutrophils from destroying the bacteria. Once in the bloodstream, Yersinia pestis secretes endotoxins that trigger excessive thrombin production, resulting in a procoagulant state within blood vessels. This leads to disseminated intravascular coagulation, DIC, where tiny clots form throughout the body, cutting off blood flow to various regions and causing tissue necrosis. The bacteria can spread to any part of the body, potentially causing multi-organ failure. If left untreated, septicemic plague can progress to overwhelming sepsis and death. Finally, pneumonic plague can develop in 2 ways. One way is when the bacteria spread to the lungs from the bloodstream, known as secondary pneumonic plague. In this case, individuals with secondary pneumonic plague can cough or sneeze, releasing respiratory droplets that can infect others. This can lead to primary pneumonic plague in those who inhale the droplets, highlighting how easily this could escalate into a pandemic situation. Symptoms of bubonic plague include fever, chills, fatigue, and the appearance of buboes, typically found in the inguinal or axillary regions during clinical examination. In septicemic plague, symptoms include hypotension, malaise, purpuric skin lesions, and tissue necrosis, which often manifest as blackened areas on the limbs. For pneumonic plague, symptoms involve dyspnea, fever, chest pain, cough, and hemoptysis, which is the presence of blood in the sputum. Plague can be diagnosed by isolating Yersinia pestis from cultures of blood, buboaspirate, and sputum, and by identifying the bacteria in a peripheral blood smear using Gram, Wright-Giemsa, or Wason staining. A 4-fold increase in antibody titer between serum samples collected at least 2 weeks apart, measured using serological tests, can also confirm the diagnosis. Additionally, a rapid antigen test can detect the Yersinia pestis F1 antigen in sputum or serum within 15 minutes. Finally, a chest X-ray may show signs of pneumonic plague, such as consolidation, which appears as white areas, or cavities, which appear as walled-off, lucent regions within the lung. Plague can be treated with antibiotics, typically aminoglycosides like gentamicin and streptomycin. Other options include doxycycline, tetracycline, fluoroquinolones, and chloramphenicol. The treatment duration is generally 10 to 14 days. Summary of Yersinia pestis. Yersinia pestis is a gram-negative bacillus that grows well on blood, chocolate, and MacConkey agar. Its virulence factors include the capsular antigen F1, which protects it from neutrophils, YOPs that inactivate macrophages, and a siderophore for iron uptake. The bacterium causes plague, which has 3 forms. Bubonic, septicemic, and pneumonic diagnosis involves identifying the bacteria in cultures from blood, buboaspirate, and sputum, or through peripheral blood smears using Gram, Wright-Giemsa, or Wason staining. Serological tests and a rapid antigen test can also confirm the diagnosis. Treatment consists of aminoglycosides, such as gentamicin and streptomycin, for 10 to 14 days.